Hello, guys and girls. I'm Dr. Omkar Sangita Dilipra Sonone, and today I welcome you all back to the session of Sparks presented to you by AFMG. And let's begin our next session of PSM revision and chanting. As you all are quite aware that we have finished with the previous sessions of PSM. Now we are only left with two sessions of PSM revision and chanting, and those are first of all, today's session will include the topics like health and disease. Okay, so screenings, sensitivity, specificity, all of these topics, along with that international health, these topics will be actually included in today's session. Whereas the last session that I'll try to conduct it offline in the classroom also, along with on the YouTube, and therefore that session will mainly focus on biostatistics, which is an important topic. Along with that, we'll also discuss one another important topic, that is communicable diseases and entomology, which covers most of the microbiology part as well, right? So let's see you. I'll see you in the session, the next one in the offline in the classroom of AFMG near Green Park, Gautam Nagar, and I hope all of you all who are in Delhi will attend the session offline as well. Along with this, now let me also make it clear that AFMG has started already its review and revise program by the renowned faculties of AFMG. So there would be mainly test and discussion. Along with that, there would be rapid revision of each subject by the faculties who have already taught subjects in AFMG. And now, along with that, you will also get free chanting and revision sessions by the Team Spark, as well as you will also get all the updates regarding the exam, as well as about any other queries that you have. All of them would be solved. So feel free to join the revise and review program of AFMG, and for that you can contact on the given numbers. Along with that, you can also contact us at the office or on through the social media handles of AFMG. Thank you so much. Now let's begin our session for today. And today we'll be actually talking about starting along with an important topic, and that would be health and disease. So let's start with this topic, guys. So first of all, we'll discuss about some important health index. Okay, so these important two health index that have repeatedly been asked in exams are usually PQLI and second one being HDI. What do we mean by PQLI? So please remember, PQLI is nothing but physical quality life index. What do we mean by PQLI? Physical quality life index. Okay, and what is the full form of HDI? HDI का full form होता है Human Development Index. HDI is Human Development Index, right? So please remember, guys, these are the two important indicators which shows us the development of a nation. Okay, so overall development of a nation. And what are the indices included in this index? So let's discuss, because this is the only question which have been asked repeatedly. Okay, और सबसे important question कहाँ से आता है? So it either comes from life expectancy, because the life expectancy in PQLI differs, and also in life expectancy in HDI it differs. Okay, so इसमें से एक exception आ सकता है, और they can also ask you exception from this one, either IMR or income. ठीक है, so बाकी तो same है. So let's see the first three indices which are included in physical quality life index, that is PQLI. The three indices included are: first is your literacy rate, okay, literacy rate. Second is your infant mortality rate or your IMR, and third is your life expectancy at 1 year of age. Life expectancy at 1 year of age, please remember. Whereas if we compare it with HDI, Human Development Index, here the indices would be: first is common one, that is literacy rate, but in literacy rate can also be known as knowledge, so don't confuse that whether knowledge is a part of it or not. So please remember, literacy rate is also written as knowledge. It is also written as mean years of schooling. याद रख लेना, literacy rate can also be written as knowledge or mean or average years of schooling. Okay, it is one and the same thing. I hope you remember this. And next, the second index of HDI would be income. Okay, second one is income. Again it differs. In PQLI it was infant mortality rate. ऐसे याद रख लो, physical quality life index बड़ा नाम, so बड़ा indicator, that is infant mortality rate. Whereas HDI में छोटा नाम, so छोटा indicator, that is income. ठीक है. Whereas the third one is your life expectancy at birth. Okay, life expectancy at birth कब है? In HDI, याद रख लेना. Okay, so please remember this. I hope you remember this. Please remember literacy rate in both, infant mortality rate in PQLI, income in HDI, life expectancy at 1 year of age, PQLI, life expectancy at birth, HDI. ठीक है, याद रख लेना. Now if we talk about the range, please remember guys, PQLI की range is from 0 to 100. याद रख लेना, PQLI index has a range of 0 to 100. On the other hand, HDI has a range of 0 to +1. HDI would be in the range of 0 to +1. If we talk about India now, so the PQLI value of India is 65. The PQLI value of India is how much? It is 65. Whereas the HDI value of India is 0.624. HDI value of India कितनी है? 0.624. And previously it was ranked as 131. Now India is ranked as 129. याद रख लेना. Now India has been ranked as 129 because the new HDI value is 0.64. याद रख लेना. Okay? Please remember this. Now moving further to the next indicator, and which is not so important, but just remember it, that is multidimensional poverty index. Okay, it is a poverty indicator known as MDPI or multidimensional poverty index because it includes all the different indicators, not only related to health but apart from that as well. So therefore the indicators which are included under multidimensional poverty index would be, first of all, health, that is nutritional assessment, second is education, and third are the living standards. And these living standards, it includes water availability, electricity, toilet facilities, and other assets. Okay, so please remember, this is about the multidimensional poverty index, and it also has a range of 0 to +1. Okay, now moving on to a very important one, that is below poverty line, BPL. बहुत बार सुना होगा, all those BPL card holders, they have a yellow ration card, right? So BPL is below poverty line. So the population below poverty line has a criteria. And what is that criteria? So please remember guys, they can be sorry, classified based on the criteria of caloric intake. Okay, based on the criteria of caloric intake. If a rural individual has a caloric intake of less than 2400 calories per day, okay, so less than 2400 kilocalories per day, then he or she would come under below poverty line. Okay, important. Second, if a urban individual has a calorie intake of less than 2100 kilocalories per day, he or she will be classified under below poverty line. Okay, so please remember, there is a different criteria for rural population as well as for urban population. Rural के लिए कितना है? Less than 2400 kilocalories per day. Urban के लिए कितना है? Less than 2100 kilocalories per day of caloric intake are considered below poverty line. Next one, talking about the income per capita. Below poverty line के लिए बस caloric intake is not the only factor. Therefore, we also talk about the income per capita. ठीक है, and income per capita ये देखने के लिए कि what should be the criteria or the cut off to classify people in below poverty line according to the income per capita. The government has actually formulated two committees. The first one was known as the Tendulkar Committee, and the second one was known as the Rangarajan Committee. Okay, so here we'll talk about the Rangarajan Committee. So according to Rangarajan Committee, they say that a rural population earning less than 32 rupees per day would be considered BPL. A rural population or rural individual earning less than rupees 32 per day would be considered under poverty line. Whereas an urban population or an urban individual earning less than rupees 47 per day, would be considered as BPL or below poverty line. I hope this is clear. And according to this committee, almost 29.5% of India's population is under the poverty line. Okay, so BPL population kitni hai? 29.5%. According to which committee? According to the Rangarajan Committee. Moving further now, talking about time distribution of a disease. Okay, so disease, as we all know, it is distributed according to time, place, and person. Right, so in various places there would be different types of diseases found. Okay, at various time there would be different types of diseases found. Right, so that is the actual thing that we are going to discuss over here. So here we are discussing about the time distribution of a disease. Okay, so time distribution of disease would have fluctuations. There can be either short-term fluctuations, long-term fluctuations, or periodic fluctuations. Right, so if we talk about short-term fluctuations, usually short-term fluctuations means the disease fluctuates within days, weeks, or months. Okay, the disease fluctuates within days, weeks, or months. That is the number of cases either rise or decrease within days, weeks, or months, and therefore short-term fluctuations are also known as epidemics. याद रख लेना, the diseases showing short-term fluctuations will show us what? They will show us epidemic. Important. Next one, if we talk about long-term fluctuations now, okay, so long-term fluctuations are usually the number of cases of a disease will vary over decades. Okay, the number of cases will vary, that is increase or decrease over decades. That will be known as a long-term fluctuation of a disease, and long-term fluctuation of a disease is known as a secular trend. Okay, long-term fluctuation of a disease will show us the secular trend, and usually secular trend is shown by communicable or non-communicable diseases, right? Important one. Then third, we talk about periodic fluctuations. Periodic fluctuations can either be seasonal or they can be cyclical. Okay, by seasonal fluctuation we mean, like for example, measles and rubella, these infections are very common in rainy season, right? Therefore these are known as seasonal fluctuations, right? Whereas other respiratory infections, they are common during winter season, or malaria and dengue are common within rainy season. So they show seasonal fluctuations. The number of cases of these particular disease rise in a particular season. Therefore this is known as seasonal fluctuation. Whereas the other one is cyclical fluctuations, when number of cases of a disease rise over a period of 2 or 3 years, or over a period of 4 to 5 years, like in cases of measles. Okay, in case of measles, usually the number of cases of measles rise every 2 to 3 years. They rise every 2 to 3 years. Whereas in cases of rubella, okay, rubella cases rise every 6 to 7 years. Okay, rubella cases rise every 6 to 7 years. Therefore measles and rubella are an example of cyclical trend of a disease. Okay. Then moving further, now talking about an epidemic. When we call a disease as epidemic, there is a definition for epidemic. Okay, please remember this. So epidemic कब होता है? When actually the disease, the number of cases of a disease is more than mean plus 2 standard deviation. Okay, mean plus 2 standard deviation. What do we mean by this? For example, अगर दिल्ली का example ले, so just take, suppose in 2018 there were 5,000 cases of dengue. Okay, next in 2019 there were 4,500 cases of dengue. Next in 2020 there were almost 4,900 cases of dengue in Delhi. Okay, so if we take an average, we'll get around something like 4,700. Okay, so this is the mean or the average of the number of cases of dengue in Delhi. So if we actually got almost 15,000 cases, okay, almost we got 15,000 of 15,000 cases of dengue in Delhi this year in 2021, then it would be considered as an epidemic. Why? So please remember, what was the mean? Mean was around 4,700. Okay, along with that there is 2 plus standard deviation. For example, the standard deviation was 700. Okay, the standard deviation was 700, so it is 1400. So here if we say 6,100 cases of Delhi, more than 6,100 cases of dengue in Delhi would be considered as an epidemic. याद रख लेना, more than 6,100 cases of dengue in Delhi would be considered as an epidemic. Okay, so epidemic is defined as number of cases of a disease more than mean plus 2 standard deviation. Okay, please remember this. So epidemic can be of different types. Okay, there are 3 different types of epidemic. First, if we talk about single exposure point source epidemic, what happens usually in a single exposure point source epidemic? So please remember, there would be a, if we plot a graph, there would be a sudden rise in the number of cases and there would be a sudden fall in the number of cases. Okay, and all the cases will actually be clustered in one single incubation period. Okay, all the cases would be clustered in one single incubation period. Therefore there would be just a one peak which will be seen. Okay, this is usually seen in single exposure point source epidemic, like in cases of food poisoning, staphylococcal food poisoning, which has an incubation period of 1 to 6 hours. Usually it would be an example of single exposure point source epidemic. Then if we talk about multiple exposure point source epidemic, guys, multiple exposure point source epidemic mein kya hota hai? Usually there is sudden rise in the number of cases, but after that the number of cases shows various peaks. Okay, these multiple peaks would be seen and there would be a sudden fall also after some time. Okay, so इसमें ये जो multiple peaks दिख रहे हैं, these multiple peaks are actually known as secondary waves. What are these multiple peaks known as? These are known as secondary waves. So sudden rise, sudden fall, but there would be secondary waves or multiple peaks. Okay, and the number of cases will not be clustered in one incubation period. Okay, याद रख लेना. It would be spread over a period of time. So this is known as multiple exposure point source epidemic. The example being, for example, in a village there is a contaminated well from which usually the whole village population is drinking water, and this contaminated water will lead to typhoid or enteric fever in that village. Okay, so there would be increase in number of cases over a time. Okay, so that is actually known as multiple exposure point source epidemic. Next, third type of epidemic is a propagated epidemic. What happens in a propagated epidemic? So please remember, there is a slow rise and a slow fall in a number of cases of a disease, but along with a plateau. Okay, so yaad rakhna, slow rise, that is over decades the number of cases have increased. Then there is slow fall, the number of cases will fall over decades, but in between that there would be a plateau, that is the number of cases will remain constant for a longer period of time. Okay, so this type of graph is usually seen in cases of propagated epidemic, and propagated epidemic is actually seen in diseases where there is person to person transmission, because the disease has to be transmitted from one individual to another, therefore the number of cases will be constant, right? So it is propagated type of epidemic. It's usually seen in diseases like tuberculosis, HIV, AIDS. Okay, please remember this. Excuse me. Now, after epidemic, if we talk about the other three definitions that you need to know, first one is endemic. Okay, what do we mean by endemic? So endemic is constant or continuous presence of a disease in a given geographical area. Okay, so constant presence of disease in a given geographical area is considered as an epidemic. For example, Japanese encephalitis is an endemic disease in states of West Bengal, Bihar, and Tamil Nadu. Okay, so this is what is known as endemic. Means a disease is constantly present in a given geographical area throughout the year. Right, there is no variation. But sometimes what happens, if the cases of this endemic disease rise suddenly more than mean plus 2 standard deviation, then it would be considered as an epidemic. याद रख लेना. So endemic disease can also show epidemics at times. Next one, the second definition is pandemic. Okay, pandemic का मतलब क्या होता है? Pandemic means country to country spread. याद रख लेना, pandemic means country to country spread. Usually, which is the disease now showing country to country spread? It was COVID-19. So therefore, COVID-19 is also an example of pandemic, whereas influenza is the best example of pandemic. Okay, याद रख लेना, best example of pandemic would be influenza, that is swine flu, H1N1. Okay, याद रख लेना. Along with that, the largest pandemic known to humankind is actually your HIV/AIDS. Okay, please remember this. And next one, the next definition is actually you need to know is your sporadic. Okay, what do we mean by sporadic? Sporadic means scattering of cases of a disease. याद रख लेना, scattering of cases of a disease is actually known as sporadic. That means a disease is not only concentrated or limited to a given geographical area, rather it is scattered all over the world. Okay, so this is actually known as a sporadic disease. And one more important definition that was not included over here, but question have been asked in EPG on that, that is exotic disease. And what do we mean by exotic disease? So please remember, an exotic disease would be the one which is newly brought to a country. A newly brought disease in a country is actually known as a exotic disease, which is not present in a country, but it is newly brought. For example, onchocerciasis. We do not have the fly for onchocerciasis, but in any case, onchocerciasis is being brought to India. This is actually known as an exotic disease, therefore. Right? Now, apart from this, let's talk about the other important definitions, that is control, elimination, and eradication. The three most important definitions that you need to know. Okay, so what do we mean by these terms? So first of all, if we talk about control, control means reduction of transmission of a disease when it is like कंट्रोल मीन्स रिडक्शन ऑफ ट्रांसमिशन ऑफ अ डिसीज. ठीक है, सो ट्रांसमिशन जो होता है ना एक डिसीज का, वो इतना कम कर दो दैट इट इज नॉट अ पब्लिक हेल्थ प्रॉब्लम नाउ. Okay, so reduction of transmission of a disease to such a low level that it is not a public health problem. That is actually known as a control of a disease. Okay, नेक्स्ट वन, सेकेंड वन इज एलिमिनेशन ऑफ अ डिसीज. एलिमिनेशन में क्या होता है? देयर इज कंप्लीट टर्मिनेशन ऑफ ट्रांसमिशन ऑफ अ डिसीज. ओके, डिसीज का जो ट्रांसमिशन है दैट इज कंप्लीटली टर्मिनेटेड. ओके, दैट इज कंप्लीटली स्टॉप्ड. बट एलिमिनेशन इज एक्चुअली अ country level or a regional level term. याद रख लेना, it is a country level or a रीजनल लेवल टर्म एलिमिनेशन, ठीक है. सो कोई भी डिसीज एक कंट्री से एलिमिनेट हो सकता है, याद रख लेना. Next, if we talk about the third term, that is eradication. So eradication is actually complete elimination of an organism or complete extermination of a disease. So इसका मतलब क्या होता है? That is the organism is completely being eliminated or eradicated from the world itself. Organism ही खत्म कर दिया. अब organism ही खत्म हो गया, that means the transmission has been stopped, right? So the disease is completely eradicated from the world. याद रख लेना. So याद रखना, इरेडिकेशन इज अ ग्लोबल टर्म. याद रख लो, इरेडिकेशन इज एन ग्लोबल टर्म. सो कंट्रोल इज जस्ट रिडक्शन ऑफ ट्रांसमिशन ऑफ अ डिसीज व्हेन इट डज नॉट रिमेन अ पब्लिक हेल्थ प्रॉब्लम एनीमोर. Second, elimination is complete termination of transmission of a disease. It is a country-wide term used. And third, eradication is complete elimination of an organism. That is a global term, right? If we talk about India, guys, so yaad rakh lo, India mein there are some diseases which have been already eliminated, okay? And what were the diseases eliminated from India? So first was guinea worm. Guinea worm, also known as Draconculiosis, was announced to be eliminated from India in February 2000. Next was leprosy. Okay, leprosy was announced to be eliminated from India in December 2005. Okay, next was maternal or neonatal tetanus. Maternal or neonatal tetanus was announced to be eliminated in July 2016, and yours also was announced to be eliminated in July 2016. याद रख लेना. So 4 diseases have been eliminated from India. Those are guinea worm, leprosy, maternal and neonatal tetanus, and yaws. याद रख लो. Whereas leprosy and neonatal tetanus have not been completely eliminated. If we talk about elimination, that means no single case of that disease should be present in a country. But leprosy or neonatal tetanus के cases तो आज भी present है. So that means actually WHO has set a criteria for elimination of these 2 diseases. And what is the criteria for elimination of leprosy? So leprosy ke cases, when the leprosy cases are less than 1 per 10,000 population. Leprosy cases, when they come down to less than 1 per 10,000 population, the country can get a elimination status for leprosy. Next one is your neonatal tetanus. When the neonatal tetanus cases comes to less than 0.1 per 1000 live births. When the neonatal tetanus cases comes to less than 0.1 per 1000 live births, then the country can be awarded a neonatal tetanus eliminated country. Okay, yaad rakho. Whereas India have eliminated polio already, but till now it hasn't got an elimination status for polio. Rather, it has just got a polio-free status. And India was awarded the polio-free status by WHO on 27th March 2014. India was awarded the polio-free status by WHO on 27th March 2014, but it is still not awarded the elimination status. याद रख लेना, India is just polio-free. याद रख लो. And which are the 2 organisms which have been completely eradicated? So yaad rakh lena, there is a single disease which has been completely eradicated, and that single disease is smallpox. Yaad rakh lo, smallpox or variola is the single organism which has been completely eradicated from world, and the date can be asked. Smallpox was eradicated on 8th May 1980. याद रख लो, the date of smallpox eradication was 8th May 1980. याद रख लो. Whereas the P2 or the wild strain of polio, as we all are quite aware, that is the P2 or the wild strain of polio was also eradicated from the world, and therefore we have changed from a previously used trivalent polio vaccine to a newer one, that is a bivalent polio vaccine, in which we only have 2 strains of polio, that is P1 and P3, whereas the P2 strain has been removed because P2 strain has been eradicated from the world. Right, moving further to our next one. Now we'll talk about surveillance. Okay, so surveillance is what? Sorry. So please remember, guys, surveillance means what? Surveillance means scrutiny of all factors related to a disease. Okay, all the factors which are related to a disease, unki scrutiny karna, that is analysis karna, interpretation karna, results nikalna, conclude karna, and then to apply it on the population. This whole process is actually known as the surveillance of a disease. Okay, so usually yaad rakh lo, surveillance is nothing but scrutiny of all factors of a disease. We have 3 different types of surveillance now. And what are these 3 different types of surveillance? So first one is your passive surveillance. Okay, Passive surveillance means when the patient comes to the healthcare system. याद रख लो, when the patient reports to the health system, it is known as the passive surveillance. Okay, and in 90% of cases, we usually have passive surveillance. Next is your active surveillance. Active surveillance means when the health system goes to the patient for searching of cases. Okay, so when the health system goes to the community in search of cases, that is actually known as the active surveillance. Okay, when health system is going to the patient, that is active surveillance. And active surveillance in the community is being carried out for diseases like malaria, where our multi-purpose worker male, okay, multi-purpose worker male at the sub-center, he goes to villages and he actually goes for peripheral blood smear examination. Okay, next one is your TB. Tuberculosis also has active surveillance in the community when our ASHA worker goes to the community and provide DOTS treatment. Okay, and next is your polio. Polio में कौन जाता है? Polio में usually our surveillance medical officer goes to the community for screening of acute flaccid paralysis in the community, right? And he sends the stool sample of polio. We have discussed it already, right? So these are the three types of these are the three diseases for which we have active surveillance right now under our health programs. Next is our sentinel surveillance. Sentinel surveillance का क्या मतलब होता है? Sentinel surveillance is actually done for diagnosing hidden or missed cases. Okay, it is actually done for just determining hidden or undiagnosed or missed cases. याद रखना. And usually these missed, undiagnosed or hidden cases are mostly due to social stigma, and therefore sentinel surveillance is actually done for diseases like HIV/AIDS. Okay, so sentinel surveillance is usually done for diseases like HIV/AIDS when the cases are either missed, hidden or undiagnosed. Right, moving further now. Talking about the different types of levels of prevention, guys, levels of prevention are of 4 types. Okay, so first is our primordial level of prevention, second is primary, third is secondary, and fourth is tertiary level of prevention. Okay, primordial level of prevention is nothing but health education. Okay, primordial level of prevention is nothing but health education. Taking the same example again, that is dengue in Delhi. Okay, so याद रख लो, जब वो केजरीवाल की जो एडवर्टाइजमेंट आती है टीवी पे, ओके, टू नॉट स्टोर वाटर और टू नॉट लेट रेन वाटर स्टोर इन एनी ऑफ योर वेसल्स और इन योर old tires वगैरह. Okay, so that is actually what? That is actually health education. Or we also have announcements throughout Delhi going for the same purpose, not let the rainwater accumulate in any man-made sources. Okay, so that is again health education. So this would be primordial level of prevention, when the even before the risk factor appears, we actually try to prevent the disease. Okay, so in primordial level of prevention, the risk factor is absent. मच्छर है क्या? अभी तक नहीं है. Okay, so even before the mosquitoes appear, we are trying to eliminate all the sources of their breeding. Okay, this is actually known as primordial level of prevention. It is done by the means of health education, and it is done when the risk factor is absent. ठीक है. Next is primary level of prevention. If we talk about the same example, अभी क्या हो गया? People लोगों ने सुना नहीं, दिल्ली वाले लोगों ने सुना नहीं, then the rainwater has accumulated already, and now the mosquitoes have started breeding. This means the risk factor is present. The risk factor for dengue or malaria is present. Okay, so now primary level of prevention is applied when the risk factor is present but the disease has not yet occurred. याद रख लो, primary level of prevention is applied when the risk factor is present, mosquitoes है but the disease have not occurred yet. Okay, and primary level of prevention can be done by either health promotion or specific protection. It can be done either by health promotion or specific protection. Okay, so for that purpose, actually for health promotion, usually different types of advertisements can be run. Okay, to actually seek medical care as soon as possible whenever patient experiences any symptoms related to dengue or malaria. Okay, so this would be your health promotion. Second is your specific promotion, specific protection. Specific protection matlab kya? The protection against the risk factor. ठीक है. So what is the risk factor? Those are your mosquitoes. So using mosquito repellents, okay, or using mosquito nets, or spraying DDT or mosquito repellents like DDT, malathion वगैरह. Okay, this all will come under specific protection, that is primary level of prevention. याद रख लो. Next, talking about secondary level of prevention. So secondary level of prevention will come when the disease has already occurred now. Okay, the disease has started to occur in the community. That is when we actually apply secondary level of prevention. And secondary level of prevention means either early diagnosis of a disease or treatment of a disease. So early diagnosis and treatment comes under secondary level of prevention. And the last one is your tertiary prevention. Tertiary level of prevention may usually what happens, the disease is still present in the community or the disease has been over. Okay, so the disease is progressing or it has been over. Okay, so tertiary level of prevention either it is disability limitation or rehabilitation. Okay, disability limitation or rehabilitation. ठीक है, याद रख लो. So now we'll talk about some examples. Before that, jaldi se risk factor not present, primordial level of prevention by means of health education. Risk factor present, disease not present, primary level of prevention by means of health promotion and specific protection. Now, disease is present, secondary level of prevention by means of early diagnosis and treatment, and disease is already progressing or it has been over, then it is tertiary level of prevention by means of disability limitation or rehabilitation, right? Now, moving to further some examples, I hope you will all answer also, okay, because this is not a live video. I hope all of you all keep answering. So first of all, vaccines कौन सा level of prevention होगा? So please remember guys, all the vaccines, okay, I'm talking about all the vaccines including BCG vaccine would be specific protection, that is primary level of prevention. याद रख लेना, याद रख लो, all the vaccines will come under primary level of prevention specific protection. Okay, because they are giving specific protection against a particular disease when the risk factor is present in the community. एक बात. Second, when we actually use BCG vaccine for treating bladder cancer, okay, as you all might be quite aware that BCG vaccine is also used for treating bladder cancer. So when BCG vaccine is used for treatment of bladder cancer, here word kya aa raha hai? Treatment. Therefore it would be secondary level of prevention. Okay, so please remember all vaccines are primary level of prevention, but when BCG is used for treatment of bladder cancer, it comes under secondary level of prevention. Next, when contraceptives, okay, all the contraceptives, all contraceptive methods are again primary level of prevention. All contraceptive methods would be primary level of prevention, that is specific protection, because they are protecting against pregnancy, right? So please remember, all contraceptive methods would be primary level of prevention, specific protection. But when combined oral contraceptive pills, that is COCPs, are used for treatment of PCOD, okay, as we all are quite aware that PCOD ke treatment mein we use COCP pills, right? So when COCPs are used for PCOD treatment aa raha hai, therefore it would again be secondary level of prevention. So second statement kya yaad rakhoge? All contraceptives are usually primary level of prevention, except when COCPs are used for treatment of PCOD, they become secondary level of prevention. Next, sputum smear for AFB. Okay, so for acid fast bacilli, uske liye jo sputum smear karte hai, it is done for diagnosis, and diagnosis comes under secondary level of prevention. Peripheral blood smear in malaria, again peripheral blood smear in malaria is used for diagnosis of malaria, again coming under secondary level of prevention. Or therefore all screening and diagnostic tests come under secondary level of prevention. Yaad rakhna. Next, chemoprophylaxis, like for example in malaria we have two drugs like doxycycline or mefloquine which are being used for prophylaxis of malaria. Prophylaxis matlab kya? Disease hone se pehle hum de rahe hain. The risk factor is present in the community, therefore to protect ourselves from the disease we are actually taking this prophylactic measures. Okay, in malaria those are usually doxycycline and mefloquine. We have discussed this in pharma. Okay, so chemoprophylaxis will actually be specific protection against a disease. Therefore, it is primary level of prevention. Yaad rakh lena, chemoprophylaxis will come under primary level of prevention, specific protection. Next, crutches used in polio. If a person is being paralyzed and he used crutches, okay, so crutches are which level of prevention? The disease has already occurred. Okay, so it is tertiary level of prevention. Yaad rakh lo, and crutches are usually used for locomotor rehabilitation. What are the reason why crutches are being used? They are usually used for locomotor rehab, right? So they are tertiary level of prevention. And lastly, physiotherapy. Again, physiotherapy done in polio is again done for locomotor rehabilitation or for disability limitation. Therefore, again, they are also tertiary level of prevention. I hope this is clear. We'll discuss more such examples in the last session after we complete PSM. Okay. Next one. Talking about spectrum of a disease. Okay. So spectrum of disease के बारे में अगर हम बात करें, there are four different types, the four different levels. First is disease, second is impairment, third is disability, and fourth is handicap. So first of all, talking about a disease, for example, diabetes mellitus or for example RTA. Road traffic accident is a disease. Okay, road traffic accident is a disease. What do we mean by impairment? Impairment means whenever there is a loss of any anatomical, physiological or psychological function of the body, that would be counted to as an impairment. Okay, so this person in a road traffic accident, which is a disease, has lost his hand. Therefore, loss of hand would be what? Loss of hand would be counted as impairment, right? Next one. Now, what is the disability? Disability means whenever the person is unable to perform daily routine activities when he is compared to the individual of same sex and gender. Okay, same sex and age. Okay, so please remember, when he is unable to perform daily routine activities, okay, that is actually known as disability. So due to the loss of the hand, this person who was a driver is not able to drive now. Okay, so inability to drive. This is actually known as disability. And lastly, what do we mean by handicap? Handicap means actually now this person, as he is unable to drive, he has lost a job and therefore is unemployed. So he is not able to actually perform his social role. That is known as handicapped. Okay, I hope this is clear. Next, talking about now the cases and carriers. Okay, this is usually I'm talking about the communicable diseases. Okay. So what do we mean by cases? There are different types of cases. Means diagnosed disease. Okay, those are actually known as cases. So first is primary case. Okay. So what we mean by primary case? Primary case means the first case of a disease. Primary case means the first case of a disease is known as the primary case. Then what do we mean by secondary case? The cases which have been acquired from the primary case. Okay, primary case की वजह से जो भी cases develop होंगे due to transmission, those would be known as secondary cases. Cases acquired from primary case are actually known as secondary cases. And secondary cases can be multiple, right? एक इंसान बहुत सारे लोगों को infect कर सकता है. So all of them would be counted to as secondary cases. And last one is your index case. So what do we mean by index case? So please remember, index case is the first case in the community which comes to the notice of an investigator. Okay, the first case in the community which comes to the notice of an investigator or the doctor or an examiner, it is considered as an index case. Index case can be either a primary case or it can be a secondary case. Okay, कोई भी case हो सकती है index case, याद रख लो. Next, moving on to some important definitions, periods के बारे में that you need to remember. So first of all, talking about incubation period. What do we mean by incubation period? Incubation period of a disease is the time period from the entry of an organism till appearance of the first sign or symptom. याद रख लो, the time period from entry of an organism in the body till appearance of the first sign or symptom is actually considered as incubation period of a disease. Right? याद रख लेना. Incubation periods, we'll discuss the important incubation periods about important diseases in the next session itself. Next, talking about the next important definition, that is median incubation period. Median incubation period is actually when 50% of cases have occurred. Okay, when like the time period in which 50% cases of a disease occurs usually. Right? अगर हम कोविड का एग्जांपल लें, कोविड का इंक्यूबेशन पीरियड कितना था? 2 to 14 days was the incubation period of COVID-19. But if we talk about 50% of cases, इसमें से 50% cases usually 5 to 6 days में हो रही थी. So usually 5 to 6 days would be considered as the median incubation period of COVID-19. I hope this is clear. Moving further. Next, talking about your serial interval. Okay, what do we mean by serial interval? So the time period from development of a primary case to a secondary case is actually known as a serial interval. The time when which a primary case is developed into a secondary case is actually known as a serial interval. ठीक है, याद रख लो ये. Next, moving further to next one, that is last important definition, that is generation time. What do we mean by generation time? So please remember guys, generation time is the time period from the entry of an organism inside the body till maximum infectivity. मैंने क्या बोला? Maximum infectivity तक. ठीक है? So from entry of an organism till maximum infectivity is your generation time. But from entry of an organism till first sign or symptom is your incubation period. ठीक है, याद रख लो ये difference. Next, talking about carriers now. Carriers मतलब जिनमें actually apparent signs or symptoms नहीं है disease के, those are actually known as carriers of a disease, right? So if we have different types of carriers, so first is your contact carrier. What do we mean by contact carrier? The carrier who has acquired a disease from a case. ठीक है. A carrier who has acquired a disease from a case is known as a contact carrier. Contact में आने की वजह से हुआ. Next is a paradoxical carrier. Paradoxical carrier is a carrier who has acquired disease from another carrier. Okay, दूसरे carrier से अगर disease आया तुम में, then you are known as a paradoxical carrier. ठीक है. Next, incubatory carrier, a person who sheds organism in the incubatory period. Okay, याद रख लेना. A person who sheds organism in the incubation period is known as an incubatory carrier. Next, convalescent carrier. What do we mean by convalescence? Convalescence means recovery. Therefore, a person who sheds organism in recovery phase is known as a convalescent carrier. A person who sheds organism in recovery phase is known as a convalescent carrier. And last one, if we talk about chronic carrier. Chronic carrier is actually a person who sheds organism for more than 6 months is known as a chronic carrier. I hope this is all clear. Moving further to our next one. We have already discussed about iceberg phenomena. Guys, iceberg phenomena में usually क्या होता है? This is your iceberg. So this is your demarcation level or water level. So the visible part of the iceberg, okay, the visible part of your iceberg is actually all your apparent cases or diagnosed cases. ठीक है. Next one, or the hidden or the submerged part. Okay, the hidden, invisible or the submerged part of an iceberg are all your undiagnosed cases or misdiagnosed cases or hidden cases of a disease. Okay, or inapparent cases, subclinical cases, all of those. Okay, all of these or asymptomatic cases, all of those would be in the submerged part of an iceberg. ठीक है. So usually iceberg phenomena is shown by many of the communicable diseases, but there are some infections which does not show this iceberg phenomenon. उस पे question आता है, and these diseases can be remembered as, I have given the mnemonic रूते मेरा, और याद रख रहे ना, रूते मेरा प्यार करके और तुम आगे गा लो फिर. ठीक है. So रूते मेरा प्यार है. So RU goes for rubella, TE goes for tetanus, ME goes for measles, RA goes for rabies, and PR goes for pertussis. So all of these 5 diseases, they do not show iceberg phenomena, because in all these 5 diseases the cases are always apparent. That is, the signs and symptoms will always be seen in these diseases. ठीक है. So 100% times the signs and symptoms are seen in these diseases. Therefore they can never be undiagnosed, they can never be subclinical or asymptomatic. ठीक है. So that is the actual phenomena, that is the actual reason why they do not show this iceberg phenomena. And what are the diseases not showing iceberg phenomena? Rute mera pyar, that is RU for rubella, TE for tetanus, ME for measles, RA for rabies, and PER for pertussis. I hope clear. Moving further now, after this, talking about the Salivants Index. Okay, definition aati hai guys, so please remember just the definition. Salivants Index is actually disability free life expectancy. याद रख लो, what do we mean by Salivants Index? It is disability free life expectancy. ठीक है. So life के कितने साल तुम्हें बिना disability के गुजारे हैं, that is actually your Salivants Index. Okay, the life years that you have spent without any disability is actually your Salivants Index. That can also be counted to as healthy life years. ये भी बोल सकते हैं ना उसको. Life years without disability means healthy life years. So Salivants Index is nothing but healthy life years. Okay, disability free life expectancy, right? Whereas the next index, it is important, it is DALY. That is, DALY is disability adjusted life years. कितने जिंदगी के साल तुमने disability के साथ गुजारे हैं, that is DALY. Okay, how many life years you have spent along with disability is actually DALY. It is opposite of Salivants, right? So Salivants for healthy life years, DALY is actually disability adjusted life years, right? And DALY is an indicator of disease burden. Okay, DALY is an indicator of disease burden, therefore. Now next, talking about screening and diagnostic test. Okay, so if we compare screening test and diagnostic test, how are they different? Let's start with that. Okay, now screening test is actually run on a healthy population. Whenever you actually organize a health camp, and for example, there is high incidence of cervical cancer in rural population of females, therefore you run pap smear or liquid based cytology in that population in a health camp. So this is usually run on a healthy population, right? Whereas diagnostic tests are usually run on cases, okay, जिनमें तुम्हें suspicion है, when the screening test has come positive, that is pap smear is positive for a particular female, उसी female पे तुम diagnostic test run करोगे, right? So this is the difference. Second difference, screening test is actually run on a whole population, बहुत सारी बड़ी population और community पे किए जा सकते हैं, whereas diagnostic test it is run on a single individual. Next difference, screening tests are usually cheaper, right? Pap smear के लिए तो क्या ज़्यादा खर्चा आता नहीं है, so it is cheaper, whereas diagnostic tests they are usually expensive, right? They are usually expensive. Biopsy होगी, MRI, CT, all of these findings, all of these tests would be expensive. Next, screening test would be faster, whereas diagnostic test would take a longer time. And the last difference is screening tests are usually inaccurate. Okay, last difference is screening tests are usually inaccurate, whereas diagnostic tests are accurate, right? So these are the important differences. Cervical cancer की अगर हम बात करें, for cervical cancer the best screening test is actually VIA. Commonly we perform PAPs, but VIA, that is visual inspection with acetic acid. Visual inspection with 5% acetic acid is the best screening test for cervical cancer, and this question was asked in FMGE June 2020 session, 21 session, sorry. Okay, so please remember this. VIA. Along with VIA, we also have liquid-based cytology, also have pap smear. And pap smear is either done with a cytobrush or a IR spatula. All of you might be quite aware of it. Okay, images aa sakti hai. Apart from this, diagnostic test for that would be a cervical biopsy, right? Diagnostic test for cervical cancer would be a cervical biopsy. Okay, so this is the difference. Moving further now, talking about sensitivity and specificity of a disease. If we talk about sensitivity and specificity, इसके लिए मेरे पास एक अच्छी सी ये है टेक्निक है. I hope you all will like it. So सबसे पहले तो sensitivity और specificity किसकी करी जाती है? Okay, we'll check the sensitivity or specificity of a test, of a screening test for that matter. ठीक है. So for example, if we talk about a screening test, okay. So usually we have screening test results. Okay, we usually have screening test results, and we have deceased individuals. Okay, we have deceased individuals, right? So in this, what happens usually? There are some individuals. Sorry. Sorry. So usually we have it the other way around. Okay, so screening test results above and deceased individuals over here. Okay, ठीक है. So screening test results क्या आ सकते हैं? Okay, screening test results can be either positive or negative. और disease एक तो present हो सकता है या absent हो सकता है, right? So this can be the case. So there might be some individuals who have the disease and जिनका screening test भी positive आया. That means this is true positive, right? This population would be counted as true positive. Next, ऐसे कुछ लोग होंगे जिनमें disease तो है, but the screening test has come to be negative. Okay, so these would be counted to as false negative. This would be counted to as false negatives. क्या बोलेंगे इनको? False negatives. Next one is what? Screening test का result positive है, but these individuals do not have the disease. So these would be counted to as false positives. And the last one is actually what? So please remember, last one is that people are not having the disease and the screening test has also come negative. So these are again true negatives. I hope this is clear. So this would be A, B, C and D, right? So now if we talk about this one, so let's see guys what is the thing over here. So sensitivity का अगर हम formula चाहते हैं, okay, let's talk about the sensitivity formula. बस formula याद रख लो, बाकी table बनाने की भी जरूरत नहीं पड़ती कभी कभी. So just remember the formula and that is very much important. Okay, just remember the formula guys. Okay, what is the formula, कैसे याद रखना है, important है, ठीक है. So please remember, if we talk about sensitivity, sensitivity में तीसरा लेटर क्या है? N है. Okay, so याद रख लेना क्या आएगा. Sensitivity N के उल्टा आता है. N is for negative, P is for positive. इतना याद रख लो, ठीक है. So N के उल्टा क्या आएगा? Negative के उल्टा is positive. Therefore sensitivity का formula would be true positives upon true positives plus false negatives. Okay, याद रख लो, false negatives. I hope this is clear. So please remember this, sensitivity का formula would be true positives upon true positives plus false negatives. ठीक है, this is the formula for sensitivity. And now if we talk about specificity, स्पेसिफिसिटी में क्या आता है, P आता है, right? That means positive. और positive के उल्टा क्या होगा, negative. So here the formula would be true negatives upon true negatives plus false positives, right? Into 100 would be there because we need a percentage, therefore into 100 should be the multiplier, right? याद रख लो. Sensitivity is true positives upon true positives plus false negatives into 100, whereas specificity is true negatives upon true negatives plus false positives into 100. So I hope this is clear. Shabash. Moving further now, if we talk about the next one, guys, now positive predictive value और negative predictive value पे बहुत कम बार questions आता है. If you want to remember the formula, those can be remembered. Otherwise, like most of the times, people usually don't remember these formulas. Okay, याद नहीं रहता है. But you can remember these formulas at least. ठीक है? Please remember. Moving further, now talking about the diagnostic power of a test. Okay, so diagnostic power of a test is actually shown by sensitivity of a test or a specificity of a test. याद रख लो. So sensitivity is actually directly proportional to true positivity of a test. Sensitivity is directly proportional to true positivity, or it is inversely proportional to false negativity. Whereas specificity is directly proportional to true negativity of a disease. Specificity is directly proportional to true negativity of a disease, or it is inversely proportional to false positivity. I hope this is clear. Now moving further, talking about precision and accuracy, not very much important, just remember the definition. So precision, for example, there is a BP instrument which is showing us readings like 140 by 90, 140 by 90 and 140 by 90. So on repeated occasions, it is showing the same reading. Okay, that is, there is repeatability. मतलब repeat करने पे values almost same है. That means there is repeatability. So the instrument is known to be precise. Therefore, this instrument would be known to be precise. Okay, so this instrument has precision in it. Second, if we talk about accuracy, accuracy कैसे समझना है? So please remember, the actual blood pressure of this individual is 120 by 80, but the machine is showing us 140 by 90, which is not close to the actual value. Therefore, this machine would be counted to as inaccurate because the value which has been shown by the machine is not close to the actual value. Therefore, this machine or this test would be inaccurate. ठीक है, याद रख लो. So repeatability, it is precision, whereas the value close to the actual value is known as accuracy. Okay, याद नहीं रखोगे तो भी ठीक है, but at least examples समझ लो तो याद रखने की जरूरत भी नहीं पड़ेगी. Moving further now, talking about an important thing, that is international health. ठीक है, so international health के logos भी देखेंगे, those are very much important. We'll see after this. So if we talk about different international organizations which are somewhere or the other related to health, let's discuss about those. First is your WHO. Okay, WHO is your World Health Organization, right? So World Health Organization was established in the year 1945, right, after First World War. So after Second World War, WHO, that was World Health Organization, was established in the year 1945, right? Whereas the constitution of WHO, it came into force on 7th of April 1948. The constitution of WHO came into force on 7th of April 1948, and therefore 7th of April is celebrated as World Health Day, right? And this is the reason why 7th of April is celebrated as World Health Day, because the constitution of WHO came into existence on 7th of April 1948. Moving further, the headquarters of WHO are located in the city of Geneva, Switzerland. याद रख लेना. So headquarters of WHO are located in which country? They are located in Switzerland, in the city of Geneva. So WHO headquarters, Geneva, Switzerland. Whereas the theme for WHO, every year WHO has some theme, okay, by which most of the countries try to comply. And these theme for 2018-2019, for both these years, it was universal health coverage. Okay, the theme, the previous year themes for WHO was actually universal health coverage, and the recent theme was support auxiliary nurse and midwives. ठीक है, support auxiliary nurse and midwives. ठीक है, so this was the recent theme that was used. ठीक है, moving further now, talking about UNICEF, that is United Nations International Children Emergency Fund. Talking about UNICEF, United Nations International Children Emergency Fund. The headquarter for this is located in New York, USA. Okay, the headquarter for this organization is located in New York, USA. The question was asked, what is What does the C in UNICEF stand for? So the C in UNICEF stands for children. याद रख लेना. United Nation International Children Emergency Fund. याद रख लेना. Okay, ना child ना कुछ और, children. It is the thing. Next one. If we this UNICEF usually has a Gobi Triple F campaign. I'll talk about it in the images itself. ठीक है. Gobi Triple F campaign is run by the United Nations UNICEF. ठीक है. Next, talking about ILO. ILO is your International Labour Organization. ILO is your International Labour Organization. याद रख लो. And International Labour Organization की भी कहाँ है headquarters? Those are also located in Geneva, Switzerland. Those are also located in Geneva, Switzerland. Next one, International Red Cross. International Red Cross के भी headquarters कहाँ होंगे? Geneva, Switzerland. International Red Cross also has its headquarters in Geneva, Switzerland. Whereas FAO, that is Food and Agriculture Organization, FAO, that is Food and Agriculture Organization, has its headquarters in Rome, Italy. It has its headquarters in Rome, Italy. Important one, right? याद रख लो. And this Food and Agriculture Organization, that is FAO, they have a Free from Hunger campaign. Which campaign is run by FAO? It is Free from Hunger campaign. Now, next talking about some important things. First of all, talking about notifiable diseases to WHO under the IHRs. IHRs are International Health Regulation. So, WHO has set some international health regulations, जिसके तहत, okay, under which we actually have to notify some diseases to WHO. Whenever any case of a disease like these will occur in the community, we need to notify WHO. And which are these diseases? So, please remember the diseases like cholera, plague, yellow fever, smallpox, wild polio, influenza, and SARS virus. That is severe acute respiratory syndrome. Also MERS virus, which is a type of SARS again. So, इनके जितने भी diseases होंगे, we need to notify to WHO. That is cholera, plague, yellow fever, smallpox, wild polio, influenza, SARS, and MERS. Important. Whereas the now there are some quarantineable diseases. Okay, quarantineable diseases matlab in case the case has to isolate, okay, a diagnosed individual or case of that disease has to isolate himself or herself in a separate room from other individuals to prevent transmission of the disease, right? These are actually known as quarantineable diseases. So let's see what is the difference actually between isolation and quarantine. Okay, we have actually known this difference now because due to COVID-19. So first of all, isolation is maximum period of communicability. Okay, so isolation is maximum period of communicability. जब तक वो disease communicable होगा, that is the maximum period till which you need to isolate. And isolation is mainly done by a case of a disease. A diagnosed case of a disease has to isolate himself or herself. Whereas quarantine, okay, quarantine is actually done for healthy susceptible individuals who are suspected to have a disease. Okay, healthy suspected individuals. ठीक है. So याद रख लेना. For example, a contact of some positive COVID-19 case, okay, he feels some symptoms or without also experiencing any symptoms, he is asked to quarantine because just he came in contact with that positive case. Okay, so separation of unhealthy separation of unhealthy suspected individuals from the community is actually considered as quarantine. So quarantine किसके लिए होता है? Healthy suspected individual, whereas isolation किसके लिए होता है? For a diagnosed case. Okay, this is fine. And quarantine is done for maximum incubation period of a disease. याद रख लेना. So COVID के लिए quarantine कितना था? Usually it was 14 days because the maximum incubation period of COVID-19 was 14 days. Right, therefore it was 14 days for COVID-19. It is maximum incubation period quarantine करना होता है. Whereas isolation is still maximum period of communicability. Until and unless the patient recovers, the patient should not come in contact with the other individuals. Right? I hope this is clear. Now there are some diseases which have been given quarantine, and these quarantineable diseases are actually diphtheria, tuberculosis, plague, smallpox, yellow fever, SARS, and viral hemorrhagic fevers like Ebola, Marburg. Okay, please remember. So which are all the quarantineable diseases? Diphtheria, tuberculosis, plague, smallpox, yellow fever, SARS, and viral hemorrhagic fevers like Ebola, Marburg. Next, okay, this was all about the international health. Now talking about bioterrorism agents, which is in turn a part of international health itself. So talking about bioterrorism agents, these biological agents have actually used for terrorism. Okay, terrorism That means killing a lot of people. Okay, so these are all the bioterrorism agents that have been used, and these bioterrorism agents have been actually classified into three groups. Okay, they have been classified under three categories. So first is category A, which consists the most dangerous bioterrorism agents. Category A consists the most dangerous bioterrorism agents because these are very easy to spread in this community, because these are very easy to be spread in the community. Okay, and these are anthrax, smallpox, plague, botulism, tularemia, Ebola, and Marburg. Okay, so category A bioterrorism agents would be anthrax, smallpox, plague, botulism, tularemia, Ebola, and Marburg. Out of which anthrax is the most commonly used bioterrorism agent, whereas smallpox is the most deadly bioterrorism agent. Most deadly is smallpox. Most commonly used is anthrax. Whereas botulism, as we have already discussed, it has the most dangerous toxin in the world. Botulism का toxin सबसे खतरनाक होता है, right? Moving further to category B of bioterrorism agents. So category B bioterrorism agents are usually less dangerous because they are less easily spread in the community. And these are the agents like brucellosis, okay, brucellosis, psittacosis, Q fever, epidemic typhus, and Clostridium perfringens. ठीक है, category B bioterrorism agents would be brucellosis, psittacosis, Q fever, which is spread by Coxiella burnetii, epidemic typhus by Rickettsia provozaki, and Clostridium perfringens, like, and psittacosis by Chlamydia psittaci. Okay. And lastly, category C bioterrorism agents are usually new or emerging diseases in a community like Nipah virus or Hanta virus or Lassa virus. Okay, Nipah, Hanta or Lassa virus. I hope this is clear. Moving further to next one. So now let's talk about the sustainable goals. And sustainable goals are given by which organization? So sustainable goals. This is the logo for. So please remember, sustainable goals are usually given by the United Nations Organization, UNO. Okay, the headquarters for UNO is located in New York, USA. Headquarters for UN is located in New York, USA, and they have given the Sustainable Development Goals. And the recent SDGs or Sustainable Development Goals were given in the year 2015. Okay, they were formulated in the year 2015, and these are to be lasted till 2030. कब तक चलेंगे? 2030 तक ये goals होंगे. We need to achieve them. Okay, out of which the goal 1 to 7 they are directly related to health. 1 to 7 goals are directly related to health. Total how many goals are there? Total we have 17 sustainable development goals. Total how many goals? 17 SDGs are there, out of which 1 to 7 are directly related to health. Okay, first is no poverty, second is zero hunger, third is good health and well-being, fourth is quality education, fifth is gender equality, sixth is clean water and sanitation, and seventh is affordable and clean energy. Okay, important ones. Moving further now, talking about biosafety level. Okay, and what do we mean by actually biosafety level? So please remember, it is important. Biosafety level is nothing but a set of precautionary measures. Okay, so it is a set of biocontainment precautionary measures that are required to isolate a dangerous biological agent in an enclosed laboratory. ठीक है, so please remember, कोई भी बहुत हार्मफुल अगर बायोटेरिज्म एजेंट हो या कोई बहुत हार्मफुल ऑर्गेनिज्म या पैथोजन हो जिस पे हमें स्टडी करना है, so all the measures to study on that organism are actually taken into consideration in an enclosed laboratory facility. Okay, that is actually known as a biosafety level. ठीक है, so there are different biosafety levels ranging from biosafety level 1 to biosafety level 4, which is the highest one. Okay, so biosafety level 1 is usually undertaken for non-pathogenic strains of E. coli and Staphylococcus. Okay, biosafety level 1 is usually undertaken for non-pathogenic strains of E. coli and Staphylococcus, whereas biosafety level 2 is undertaken for pathogenic strains of Staphylococcus, pathogenic strains of E. coli, Plasmodium falciparum, and Salmonella. Okay, BSL2 is usually undertaken for pathogenic strains of Staph, pathogenic strains of E. coli, Plasmodium falciparum, and Salmonella. Next, BSL3, that is biosafety level 3, is undertaken for SARS, MERS or tuberculosis. Okay, so SARS virus, MERS virus या Mycobacterium TB के लिए we usually undertake biosafety level 3. And lastly, biosafety level 4 is undertaken for Ebola and Marburg viruses. Biosafety level 4 for Ebola or Marburg viruses. SARS अगर BSL3 में आता है, so COVID-19 will also come under BSL3 because it is SARS novel coronavirus 2019, right? Next, talking about some important health communication methods now. Okay, so if we talk about health communication, okay, communication means nothing but exchange of ideas, feelings, emotions. Okay, so that is actually what we mean by communication, which in regards to health is actually known as health communication. So health communication के दो different types हो सकते हैं. First is one way communication, जब बस एक इंसान बोलते जा रहा है, दूसरा इंसान सुनते ही जा रहा है. That is known as didactic method of communication. That is known as didactic method of communication, one way. Whereas a two-way method of communication is known as Socratic method of communication. Two-way method of communication is known as Socratic method of communication. Okay, we have different types of health communication methods. Let's discuss about them. First is the lecture method. Lecture में क्या होता है? It is also known as the chalk and talk method. One lecturer is just giving a lecture of almost 30-40 minutes for an audience of less than 30 like audience less than 30 in number. Okay, and there is no question and answer session. So lecture is actually a one-way method of communication, that is a didactic method of communication. Next is your focus group discussion, FGD. FGD में क्या होता है? There is a group of people like in round table conference, and these group of people are actually conversing with each other, out of which one is the leader who will initiate the communication and the other one is a recorder, will record all these communication. Okay, and he'll draw a diagram like this. तो मतलब इसने बोला, फिर इसने बोला, फिर इसने बोला, फिर इसने बोला, and this actually diagram is actually known as a sociogram. This diagram is known as a sociogram. So sociogram is nothing but a graphic representation of a focus group discussion. And focus group discussion में हर एक को बोलने का मौका मिल रहा है. So therefore it is a two-way method of communication or Socratic method. Next, your panel discussion. Panel discussion में क्या होता है? There is a group of 4 to 8 experts sitting on a stage and discussing about an important topic, and at the last the audience also gets a chance to ask questions to these individuals, right? So this is actually a panel discussion. जो news channel पे चलते हैं ना झगड़े, all of those are your panel discussions. Again, it is a two-way method of communication, so it would come under Socratic. Next, workshop. Workshop is nothing but a series of lectures which are present in a such a way that the people will understand it. Okay, we actually perform all the skills, we learn all the skills. That is actually a workshop. It is also two-way, therefore Socratic again. Next is symposium. Symposium means a series of lectures, one back to back. Okay, series of lectures, set order of speeches is present in this. And symposium maybe there is a Q&A session, therefore it is Socratic method of communication. Next is role play. Role play is also known as street play, street drama or nukkad natak, in which important health topic is conveyed to the community in such a way that they can easily understand it. The audience should be less than 25. Okay, and usually it is played by some medical students in the community to make them aware of malaria or dengue cases. Okay, how to prevent it. Okay, or how to actually perform a breast self examination and how much it is important to perform it. Okay, so please remember this. So this is your role play, and at the end of role play also there is Q&A session. So again, Socratic or two-way method. Next is seminar. Seminar is actually taken. Seminar or conferences are usually undertaken at university, national or international levels, right? So there is also a set of speeches at the end of which there will be Q&A. So again, it is a two-way method of communication. Next is IPC, that is interpersonal communication. Okay, interpersonal मतलब दो लोगों के बीच संवाद. Okay, दो लोगों के बीच अगर communication हो रहा है, one-on-one communication, this is known as interpersonal communication, which is the most effective method of communication between a doctor and patient. The most effective method of health communication would be interpersonal communication. Next is demonstration. Demonstration is usually done for showing something, like for ORS preparation. Okay, to show mothers how to prepare an ORS for their child. So for ORS preparation, you usually make them. Okay, the nurses usually make them and show it to the community. This is a demonstration. Again, two-way. Your individuals can ask questions. So it is Socratic. Next is flannel graph. Flannel graph means series of photographs have been attached on a cardboard वगैरह and they are shown to the community and we explain them. So that is a flannel graph. Okay, but here no question and answers are allowed, therefore it is again a one-way method of communication. ठीक है, so flannel graph is one way, lecture was one way. Apart from this, TV, radio, newsprint, all of these are again one-way method of communication. ठीक है. Next is spikes or gather approach. Important thing, spikes or gather approach are actually sorry, spikes or gather approach, both of these are two-way methods of communication or Socratic method of communication. याद रख लेना, ठीक है? Please remember the spikes or gather approach. Gather approach also has a different name, that is cafeteria approach, and gather or cafeteria approach is usually used for contraceptive counseling. ठीक है? Moving further, now talking about some other important definitions. Those are culture, acculturation, and customs. So culture means a learned behavior which is socially acquired. ठीक है? A learned behavior which has been socially acquired from the community around. That is a culture. Second is acculturation, that is mixing of two cultures. If two different individuals of two different cultures have married together, so there would be mixing of two cultures. This is known as acculturation. And lastly, customs is what? Customs is patterns of behavior which are relevant for a social setting. For example, a person from Nagaland will behave in a particular manner. That is a pattern of behavior will be different according to his social setting over there in Nagaland. Okay, so this is actually known as a custom. Then we talk about other definitions like opinion. What do we mean by opinion? Opinion are just temporary views which are subjective. Okay, so please remember what is subjective and objective. So difference between subjective and objective ये होता है. Subjective are those ideas which are which has a different perception. Okay, मतलब हर एक का idea अलग होगा. So perception would be different of each and every individual about a topic. That is known as a subjective idea. Okay, interpretation would be different. Okay, whereas objective, it can be a established fact about something, or most of the peoples will share the same idea about the same thing, about a particular thing. That is a objective idea. Okay, yaad rakho. So opinions are usually temporary views about a topic, and these are usually subjective. Okay, they differ from person to person. Whereas beliefs are usually permanent views. Okay, beliefs are usually permanent views, and they are subjective. Okay, they are usually subjective again. Whereas attitude of an individual is the permanent ways of behavior. Attitude of an individual is a permanent way of behavior, and that is completely objective. Next, habit. Habit की अगर हम बात करें, it is accustomed way of doing particular things, and those are repeated again and again and again and again repeated. Therefore, those are known as habits, right? So, next one is emotion. Emotions are nothing but strong feelings. And a question which has been asked earlier also, which is the most common emotion. So there are multiple queries still now. So please remember, most common emotion, if we search in most of the books, it is joy. Most common emotion, most of the books tell it is happiness or joy, followed by love. Okay, so most commonly it is joy or happiness, followed by love, followed by some books say it is anxiety or fear. Okay, anxiety or fear, याद रख लेना, ठीक है? So I hope this is clear. It can differ, or like it is a question overlapping from psychiatry also, so it differs. Definitely this question differs. Then next, talking about healthcare in India, we have already discussed about this, guys. You already about this topic I have told you in details, but just telling you about some important points that were left. So if we talk about healthcare in India, okay, healthcare in India is actually divided in various levels, right? It is divided into various levels. If we divide it in various levels, first of all, we have a primary level. We have a primary level, that is our PHCs or subcenters, right? Next is our secondary level, where we have our community health center or CHCs or CHCs usually, right? Or taluka hospitals. And lastly, there is a tertiary level where we usually have our district hospitals or medical colleges, right? So in these three different levels, our Indian healthcare or health system is divided into, right? So if we talk about primary healthcare के बारे में, usually a Alma-Ata conference was held. Okay, Alma-Ata conference in Kazakhstan, it was held in the year 1978, and in this primary healthcare के there were sorry, primary healthcare के लिए they came to a conclusion that for essential healthcare 4 A's are required. And what are these 4 A's of essential healthcare? Those are important. So please remember, the 4 A's of essential healthcare were acceptability, affordability, availability, and accessibility. So the healthcare system should, or the healthcare should be acceptable by all, then it is affordable to all, it is available to everyone in the society, and it is accessible to everyone in the society. So these are the 4 components of essential or primary healthcare of Alma-Ata conference of 1978. So 4 A's of primary healthcare or essential healthcare from Alma-Ata conference of 1978 are एक्सेप्टेबिलिटी, अफोर्डेबिलिटी, अवेलेबिलिटी एंड एक्सेसिबिलिटी. याद रखना यहाँ दूसरा कोई ए डाल के कंफ्यूज करा जा सकता है फॉर एक्सेप्शंस अगेन. Okay, so this can be a probable question. Moving further, talking about 4 pillars of primary healthcare. Here we were talking about 4 components of primary healthcare. Now we are actually talking about 4 pillars of primary healthcare. If they ask a question about 4 pillars of primary healthcare, याद रखना इस पे क्वेश्चन पूछा जा चुका है on 4 pillars of primary healthcare, and these 4 pillars of primary healthcare are: first is equitable distribution, second is appropriate technology, third is community participation, and fourth is intersectoral coordination. Right, there should be equitable distribution of healthcare among among both the sexes, or rather all the sexes, in all the classes of the society, right, in all the genders, in all ages. Then there would be appropriate technology used, like ORS vagara is used for diarrhea, okay, or vending machines are being used nowadays for contraceptives. Then community participation, like ASHA worker or other people from community are to be included in the healthcare. And lastly, intersectoral coordination, that there should be a coordination between different sectors of healthcare. Okay, so these are the 4 pillars of primary healthcare. Moving further now, we have discussed about different levels of healthcare in India: primary, secondary, and tertiary. Next, talking about population norms for these, we have already discussed it, just revising it once again. Sub-center. Okay, what is the population norm for sub-center? So please remember guys, sub-center के लिए in hilly areas, one sub-center for 3,000 population. Okay, in hilly, tribal, or difficult to access areas, one sub-center for 3,000 population, whereas in plains, one sub-center for 5,000 population. In plains, one sub-center for 5,000 population. Next, talking about PHC. PHC again, in hilly areas, one PHC per 20,000 population. Okay, in hilly or tribal areas, one PHC per 20,000 population, whereas in plains, one PHC per 30,000 population. In plains, one PHC per 30,000 population. Next, if we talk about a CHC, okay, CHC in hilly, tribal, or difficult to access areas, one CHC per 80,000 population. One CHC per 80,000 population, whereas in plains, one CHC per 1,20,000 population. One CHC per 1,20,000 population in plains. ठीक है, so ये बहुत ज़्यादा important population नाम है, ये बिल्कुल नहीं भूलना है. Along with that, also remember the population norm for Anganwadi center also. One Anganwadi center in hilly and tribal areas for 300 to 800 population, whereas one Anganwadi center in plains for 400 to 800 population. ठीक है, don't forget this. Moving further now, if we talk about the population norm of a pharmacist, so one pharmacist per 10,000 population is the population norm. One lab technician per 10,000 population again. One lab technician per 10,000 population. One TB microscopy unit. If we talk about a microscopy unit, then one TB microscopy unit for 1 per 1 lakh population. Okay, 1 per 1 lakh population, one TB microscopy unit. Whereas one tuberculosis unit overall, if we talk about one TB center. Okay, one TB center or one tuberculosis unit, it is 1 per 5 lakh population. It is 1 per 5 lakh population, and therefore a senior TB supervisor, TB lab supervisor is also 1 per 5 lakh population. Right. Now, if we talk about number of beds, so याद रख लेना, usually sub center has no beds. Okay, याद रख लो, sub center usually has no beds. Then PHC में beds होता है. PHC में there are 4 to 6 beds. Okay, PHC we have usually 4 to 6 beds. CHC में we usually have 30 beds. Okay, CHC may usually have 30 to 46 vagara beds. Next, if we talk about staff, sub-centers have been divided into 2 types: sub-center A and sub-center B. So sub-center A may usually we have 3 staff, and sub-center B may usually have 4 staff. Which is the healthcare worker located at sub-center? It is the multi-purpose worker. So one multi-purpose worker male and one multi-purpose worker female. Okay, और sub-center B में क्या होता है? Usually there are higher number of deliveries. Therefore, sub-center B में there is one more multi-purpose worker female. याद रख लेना. B में there is one more MPW female. Next one, PHC. PHC is also divided into 2 types. If less than 20 deliveries, then it is PHC type A. If more than 20 deliveries, it is PHC type B. Okay, so PHC A में there are almost 13 to 18 staff. In PHC A there are 13 to 18 staff, whereas PHC type B में there are 14 to 21 staff. Right. Next, and which is the healthcare worker located at PHC? It is the health assistant. ये भूल जाते हो बार बार, please don't forget it. Health assistant is located at the level of PHC, Primary Health Center. Next is your CHC, Community Health Center mein usually we have 46 to 52 staff, where there would be medical officer, all the healthcare workers. Along with that, there would be specialists. Okay, there would be Ayush officer. Okay, all of them would be there. Next, talking about the grassroots level workers now, and this is very much important, guys, to know about these grassroots level workers, because on this questions have been asked. We have already discussed this. You can refer to that. Just revising it once again now. Okay, so ASHA worker, what is the population now? So 2 ASHA worker per 1000 population. Okay, 2 ASHA worker per 1000 population. What is the education required? ASHA worker should be 10th pass. ASHA worker should be 10th pass. What is the training duration? So please remember, the training duration is usually 23 days. Training duration is usually 23 days. And at which level is the ASHA worker located? ASHA worker is usually found at the village level. Next, talking about USHA worker now. USHA worker is usually found at which level? So USHA worker is usually found in urban cities. Okay, she is found at urban cities. It is urban social health activist, whereas ASHA was accredited social health activist, right? So now USHA is located at village level, right? And what is the education? So please remember, again, it is 10th grade which she should be passed. And what is the population norm for USHA worker? 1 per 2500 population. 1 per 2500 population. Next, talking about multipurpose worker, who is located at the sub-center. Multipurpose worker, male or female, located at sub-center level. What is the population norm? It is same as the sub-center. So 1 multipurpose worker per 3000 or 5000 population according to the area. 1 per 3000 in hilly areas, 1 per 5000 in plains. Okay, what is the education required? So please remember, usually the education required is 12th pass. So multipurpose worker should be usually 12th pass, and the training duration is usually 12 months. Next, talking about village health guide. Village health guide is usually located at the village level. Okay, village level. What is the education required? Village health guide should be 6th pass only. The population norm is 1 per 1000. We have discussed this already. And the training duration is of 3 months. Training duration is of 3 months. Next, traditional birth attendant. Traditional birth attendant is again located at village level. There is no education level required. Only she knows how to do a delivery. Okay. She is also 1 per 1000 population, whereas the training duration is 1 month. Training duration is 1 month. And lastly, if we talk about the Anganwadi worker. Anganwadi worker is usually 1 per 400 to 800 population. Okay. It also differs. 1 per 300 to 800 in hilly or tribal areas, and 1 per 400 to 800 in plains. Right. What is the education level? 10th pass. Okay. Anganwadi worker should be 10th pass. She is located at usually Anganwadi center. She is usually located at Anganwadi centers. And what is the training duration? So 4 months. Okay. Yaad rakh lena. 4 months is the training duration for your Anganwadi worker. Okay. So this was about all your healthcare workers who work at the grassroots level. Next, if we talk about Ayush officers, Ayush is what? Ayush is means it is the alternative forms of medicine. That is Ayurveda, Ayurveda, Yoga and Naturopathy, Unani, Siddha and Homeopathy. Okay, there is a separate department of Ayush under the Ministry of Health and Family Welfare. Okay, you need to remember the logo that we have discussed already. Okay. Now, if we talk about family planning and contraception, which is the last topic for today. So, family planning and contraception is important, guys, which is an overlapping topic from obstetrics also. So, first of all, we'll talk about CPR, that is couple protection rate. Okay. So, couple protection rate ka formula kya usually? Number of protected couples upon number of eligible couples into 100. Okay. So, number of protected couples means the couples who are using contraception upon the number of eligible couples who are eligible to use contraception into 100. Okay. And how much percentage of population of India or eligible couples in India are actually using contraception? So only 54% couple protection rate is seen in India. Only 54%. And we have discussed yesterday. Okay, couple protection rate should increase to more than 60%. Therefore, the net reproduction rate will be 1, and therefore we will be able to achieve a total fertility rate of 2.1. Right? So this was discussed. So couple protection rate is number of protected couples upon eligible couples into 100. Current CPR of India is 54%. Next, if we talk about contraceptive failure. Okay, contraceptive failure is actually determined by two indexes. First is your Pearl Index and second is your life table analysis. Okay, first is your Pearl Index and second is your life table analysis. So Pearl Index का formula क्या है? Number of accidental pregnancies upon total months of exposure into 1200. याद रखना, multiplier is important. 1200 is the multiplier. So Pearl Index का formula is number of accidental pregnancies upon total months of exposure into 1200. But the better index to be used for assessing contraceptive failure is life table analysis. Better index to be used is life table analysis, but commonly used is Pearl Index. Next, if we talk about conventional contraceptives, okay, if we talk about conventional contraceptives like the barrier methods, okay, so please remember conventional contraceptives are usually the barrier methods which are commonly used by the community. Okay, they are usually commonly used by the community. Next one, if we talk about spermicide, okay, so spermicide are the ones which will kill the sperm, okay, and there is a chemical which is used as a spermicide and it is known as non-oxynol 9. क्या बोलते हैं उस chemical को? It is known as non-oxynol 9. And this non-oxynol 9 का क्या काम होता है? It actually, how does it work? What is the mechanism of action? So please remember, it damages the plasma membrane of the acrosomal cap of a sperm. Okay, it damages the plasma membrane of acrosomal cap of the sperm. Okay, so this is the mechanism of action of non-oxynol 9, which is used as a spermicidal jelly. Next one, talking about interception. Interception, also known as emergency contraception, also known as post-coital contraception. Okay, so after unprotected sexual intercourse, usually we can use this interception, emergency contraception, or post-coital contraception, which is the most common method used. So please remember, the most common method of interception used are, please remember, it are your COC. Those are your COCPs. याद रख लेना. The most common method of interception or emergency contraception used are your COCPs, that is combined oral contraceptive pills. But if they ask you about most effective method of interception, so please remember the most effective method of interception would be IUCDs. Okay, intrauterine contraceptive devices, IUCDs. Most effective are IUCDs. Please remember this. Okay, so please remember COCPs or POPs like combined oral contraceptive pills or progesterone only pills, okay, or RU486, that is mifepristone, those are to be used within 72 hours. Whereas IUCD is a device which can be used up to 5 days, Therefore, most effective one is your IUCDs. Next, if we talk about COCPs, that is combined oral contraceptive pills, they are usually given by the UTSP and Lancer regime. क्या बोलते हैं उस regime को? UTSP and Lancer regime. When 4 pills are given, okay, 2 doses are given of 4 pills each, with a gap of 12 hours in between, and they should be given within 72 hours. So COCPs are given by which regime? UTSP and Lancer regime. कितने pills एक time पे? 4 pills एक time पे. कितने doses? 2 doses. कितना gap? 12 hours gap. Given up to how many hours? Up to 72 hours. ठीक है? Next is your progesterone only pills, also known as mini pills, okay, or lactational pills, because POPs or lactational pills are preferred in cases of lactation because they only contain progesterone. They do not contain estrogen, right? So progesterone only pills are usually given again in 2 doses, but this time only 1 pill is given. Okay, so 2 pills दी जानी चाहिए, 2 doses देने हैं with a gap of 12 hours in between and given up to 72 hours, right? Please remember this. Sorry, moving further guys, now talking about natural methods. If we talk about natural methods of contraception, there are different ones like billing method, calendar method, rhythm method, and cervical mucus method. I'll show you the images, those are important. Next, if we talk about IUCDs now, which are the most effective method of interception or emergency contraception, okay, there are total 3 generations of intrauterine contraceptive devices, okay. So the question can be asked as, which is the most common side effect of IUCD? So please remember, most common side effect of IUCD is bleeding. याद रख लेना, most common side effect of IUCD is bleeding. But which is the most common side effect of IUCD which is responsible for removal? So याद रख लेना, the most common side effect which is responsible for removal is pain. अगर pain होता है तो removal is the only thing. Okay, याद रख लेना. Most common side effect overall is bleeding, but most common side effect responsible for removal is pain. Questions have been asked on both of these, so please remember this. Moving further now, if we talk about COCPs, combined oral contraceptive pills, क्या होता है content? As all of you will be quite aware of this, so it contains ethinyl estradiol, that is the form of estrogen. Okay, it contains ethinyl estradiol. Along with that, it contains a form of progesterone known as levonorgestrel. कितना होता है ethinyl estradiol? Ethinyl estradiol is 30 microgram or 0.3 milligram. Ethinyl estradiol is 30 microgram or 0.3 milligram, whereas levonorgestrel कितना है? Usually it is 150 microgram. Levonorgestrel is 150 microgram. I hope this is fine. Right. So COCPs, due to the presence of estrogen, they are they are contraindicated in some situations. And what are the situations in which COCPs are contraindicated? So yaad rakhna, in cases of cervical or breast cancer. In cases of cervical cancer, breast cancer, first thing. Second, in cases of liver diseases, okay, because as we all know, COCPs are at a risk of causing hepatic adenomas, a tumor of the liver. Hepatic adenoma की risk होती है when a patient takes COCP pills. Therefore, if a patient is already suffering from liver disease, COCPs are contraindicated. Third is abnormal uterine bleeding, abnormal or an undiagnosed uterine bleeding. Okay, that is a contraindication for using COCPs. Next, thromboembolism. As we are quite aware that estrogen is a estrogen can lead to formation of thrombus. Okay, so therefore thromboembolism is a contraindication. Next, cardiovascular diseases. Then hyperlipidemia and pregnancy. All of these are contraindications for using combined oral contraceptive pills. Okay, क्या क्या? Breast and cervical cancer, liver disease, abnormal or undiagnosed uterine bleeding, thromboembolism, cardiovascular diseases, hyperlipidemia and pregnancy. Next, if we talk about the Sencroman, okay, if we talk about Sencroman is actually nothing but ormeloxifene. Sencroman क्या है? Sencroman is the brand name for that tablet. So Sencroman is nothing but ormeloxifene. And ormeloxifene क्या है? Ormeloxifene is a SERM. SERM means selective estrogen receptor modulator. Okay, it is from which group? Selective estrogen receptor modulator. Okay, it is ormeloxifene, famous by the brand name Sencroman. Okay, it is given once a week and it was launched by the Central Drug Research Institute, Lucknow. It was launched by CDRI, Lucknow. Next, Gossipol. So please remember, Gossipol is a male contraceptive pill. याद रख लेना, Gossipol is what? Gossipol is a male contraceptive pill. Important one. Okay. Next one, talking about Depo Contraceptives. Depo means longer acting. Okay, Depo means एक साथ बहुत ज़्यादा दे दो and they will release it slowly. So this is a longer acting contraceptive use. Depo means, okay. So Depo Contraceptive is DMPA. That is Depo Medroxyprogesterone Acetate. Depo is what? Depo Contraceptive का example is Depo Medroxyprogesterone Acetate, also famous by DMPA or by the brand name Antra. It is famous by the brand name Antra, and it is given how much? It is given 150 milligram as an intramuscular injection in every 3 months. Okay, this Antra or DMPA injection is an intramuscular injection which contains 150 milligram of DMPA given every 3 months. Important, frequency was asked. It is given every 3 months. Next one, the other one, Depo Contraceptive, is norethistérone enanthate. Okay, the second one is norethistérone enanthate, and it is given as 200 milligrams of intramuscular injection every 2 months. Okay. Next one, if we talk about Norplant. Norplant is nothing but actually a subdermal implant. Okay, it is a subdermal implant of a contraceptive, Norplant, which slowly releases the contraceptive or progesterone. Okay, so it requires a surgical procedure for implantation of Norplant. It is usually implanted in the forearm here. Okay, yaad rakho. Next, talking about the sterilization, which are the most effective method of contraception. I'm not talking about most effective method of interception, because sterilization cannot be a method of interception. Yaad rakh lena. Interception or emergency contraception is done immediately after a unprotected sexual intercourse, right? So in cases of interception, IUCDs are the most effective one. But if I talk about overall contraception, the most effective ones would be your sterilization methods, that is tubectomy or vasectomy. Okay, tubectomy is done in females, which is most commonly performed, whereas vasectomy is done in males. Okay, non-scalpel vasectomy, which has better results and less failure rates in males. Moving on, and with this, I hope we are done with most of the topics. And for today, I'll end the session over here. And thank you so much. Let's meet in the next session. Just in meanwhile, let's first of all discuss some important images that we are left with, and then I'll call up the session for today. Okay, we have left with some important topics and that you need to know. So let's discuss about some important images. Okay, just give me a minute. And yeah, we have discussed about these gentlemen already. We have discussed about epidemiology, all these studies we have discussed. This was about the pyramids that I was talking about in the last session, right? I was talking about these in the last session. Developing countries ke liye or developed countries ke liye, right? Important ones. Then moving further, okay, moving further. These are all your barrier contraceptives. So please remember, these are your barrier contraceptives. Please remember, this is a male condom. Okay, this is a male condom. Pearl index is 2 to 14 per 100 women years. It is 2 to 14 per 100 women years. Okay, next is the female condom. Female condom ka pearl index is 5 to 21 per 100 women years. Next is your vaginal sponge. Vaginal sponge is famous by the brand name Today. This is a vaginal sponge. It is famous by the brand name Today, and the pearl index failure rate is high. That is 9 to 20 per 100 women years. Okay, and in vaginal sponge we usually need to use a spermicidal jelly. We usually need to use a spermicidal jelly, and the important thing being that this vaginal sponge should be inserted 4 hours prior and 4 hours after it should be kept. Okay, so this is the requirement. Next is this vaginal diaphragm. Vaginal diaphragm is a reusable device. Important thing, it is a reusable contraceptive device. Pearl index is 5 to 20 per 100 women years. 5 to 20 per 100 women years. And for this also a spermicidal jelly is required. Along with it, spermicidal jelly is applied. Okay, first thing. And it should be inserted 4 hours prior, and it should be kept 6 hours after the intercourse. Moving further, talking about intrauterine contraceptive devices, IUCDs. We have discussed about this already. The Pearl index of intrauterine contraceptive devices is 1 to 5 per 100 women years. It is 1 to 5 per 100 women years, and it is the best method of emergency contraception, also known as interception. It is best method of interception. Yaad rakh lena. Next, moving further, we have 3 different types of IUCDs, 3 generations of IUCDs. So this is the first generation IUCD. Okay, first generation IUCD, that is Lippes loop. Okay, so this is a plastic IUCD, that is a Lippes loop, and it has the highest failure among all the IUCDs. It is a non-medicated and a inert. Sorry, it is a non-medicated and a inert IUCD. Next was our second generation IUCD, which are very commonly used in India. So these second generation IUCDs are bioactive. They release some metallic material, okay, and these are usually copper T. Okay, the image that has been shown in the image that has been shown over here is copper T 380A. Okay, इसमें हर एक line का importance है. So please remember, Cu is signifying the metal which has been used. Over here it is copper, therefore it has been used as Cu. Okay, next T, it is the shape of the device. Okay, T signifies the shape of the device. T जैसा दिखता है ना. Then 380 actually signifies the surface area of copper used. Okay, so 380 millimeter square का copper use किया गया है for winding around. Okay, over here. ठीक है, so 380 millimeter square. Then A signifies the vertical length of the limb. Okay, this vertical length of the limb is actually signified by the alphabets like A, B, and C. Important one. Okay, so A is how much? So please remember, A is 22.5 centimeters. Then B is 25 centimeters and C is 27.5 centimeters. So sometimes you will find copper T 380A. Sometimes you will find copper T 220C. Okay, so likewise. So A, B, C or alphabets usually are signifying the length of the vertical limb, and this is the thread, and this thread usually will hang in the vagina, and this thread, with the help of this thread, usually removal of this IUCD can be done. Okay, yaad rakh lena. Next is your Mirena. Mirena is actually a third generation IUCD. Apart from Mirena, we also have a third generation IUCD known as Progesta Cert. Okay, it is known as Progesta Cert. So Mirena or Progesta Cert, both of these IUCDs are actually medicated IUCDs. They contain levonorgestrel on it. Okay, they contain progesterone, that is levonorgestrel is present on it. And यहाँ पे क्या difference है? So it is made up of plastic, and second thing, there is a dip in this T. Okay, there is a dip in this T. Thread is also present in this device as well. Okay, so Progesta Cert or Mirena are third generation IUCDs which are being used. Okay, these are other contraceptive pills that we need to remember. So this is usually Chaya. This is the packet known as Centroman. Okay, so please remember, this was your Centroman, which is also famous by the name Chaya Saheli. Okay, it is also famous by the brand name Chaya or Saheli. It is actually a Centroman, or it contains what? It contains actually ormeloxifene. It contains ormeloxifene, which is a selective estrogen receptor modulator, SERM, and it is once a week pill. Right. Next one is your Antra. Antra was a Depo Contraceptive. DMPA होता है इसमें, that is Depo Metroxyprogesterone Acetate, DMPA. It is an intramuscular injectable hormonal contraceptive which is given every 3 months. Right? कितना डोज होता है? यहाँ पे लिखा है देखो, 150 milligram. Next one, talking about Mala N and Mala D. So please remember this Mala N and Mala D usually these are combined oral contraceptive pills. Okay, COCPs होते हैं इनमें. So this is the blister pack which we have for these tablets. So we have usually 21 days of tablets, and lastly after 21 days we usually stop this COCPs. After we stop this COCPs, the female has withdrawal bleeding. फिर क्या होगा? Withdrawal bleeding हो गया. And this is actually done for regular periods, right? So the female will get regular periods along with this, so there would be withdrawal bleeding. Why are these 7 white color tablets given? So please remember, these 7 white color tablets are usually ferrous sulfate tablets. Okay, these 7 tablets are made up of ferrous sulfate. 60 milligram of ferrous sulfate tablets hota hai ye, and these are given to like this are given for continuity, and they also prevent anemia, okay, due to excessive blood loss. Yaad rakhna. Next is COCPs we have discussed. They are given by this USP and Lancer regime. 4 pills are taken at a time, then 12 hours apart. Again we take 4 pills, and this should be taken within 72 hours. Ethinyl estradiol hota hai 30 microgram, levonorgestrel hota hai 150 microgram. Usually Mala N is a free tablet which is given. Mala D cost 3 rupees. ठीक है, याद रखना. Moving further, then talking about this methods of sterilization. I didn't like the image for vasectomy is missing. I'll show you in the next session. So sterilization is a permanent method of contraception. Pearl index is less than 0.1 per 100 women years. Vasectomy is a much better contraceptive method as compared to tubectomy. So please remember, tubectomy is this one when the fallopian tubes of the oviducts are ligated. Okay, they are cut and tied. So this is the most commonly used method. It is performed in females. Most commonly used technique is Pomeroy's technique. So most commonly used technique for tubectomy is Pomeroy's technique. Then if we talk about vasectomy, vasectomy usually is a non-scalpel vasectomy which is performed. In it, nothing, just a small incision is given. Then definitely a vas deferens is pulled out. We cut that vas deferens, we tie it, and then we reposit it back in the normal anatomical position. Okay, this is actually known as vasectomy. It has less failure chances as compared to tubectomy. Iska Pearl index is 0.2 per 100 women years. Iska Pearl index is 0.1 per 100 women years. Okay, advice post vasectomy, a question which has been thrice asked. So please remember, after a individual has undergone vasectomy, a male, what is the advice you will give him? So please remember, the best advice is abstinence. That abstinence, no sexual intercourse till 3 months after the procedure. Or apart from this, advice post vasectomy can also be given as use barrier methods for 3 months at least, because abstinence is difficult. Therefore barrier methods can be used for 3 months. Okay, so please remember, this is important. This was a question also asked in August 2020 session. I hope this is fine. And this is the Billings ovulation method. Okay, so यहाँ पे तुम safe और unsafe period में देखते हो. Okay, so usually as we all know, 11 to 16 day 11 to day 16 are considered usually the unsafe days or fertile days. Okay, in this usually sexual intercourse is to be avoided, whereas the other days are considered to be safe. And according to this Billings ovulation method also, you can perform contraception which was performed during the earlier days. This is a natural method of contraception. I hope this is fine. We have discussed much about this. Now we have already discussed about biomedical waste. Right, so we'll discuss about all the other things in the upcoming session. Let's discuss about this international organizations. So please remember, if we talk about international organizations, guys, the first logo that you can see over here is for the World Health Organization. This logo is for your World Health Organization or WHO. Established in 1945, Constitution came into force on 7th April 1948. Therefore celebrated as World Health Day. Headquarters in Geneva, Switzerland. Next logo that we have, यहाँ पे बच्चा और माँ दिख रही है, that is for UNICEF, United Nations Children's Emergency Fund, headquartered in New York, USA. They launched the Gobi Triple F campaign. This next one, यहाँ पे क्या था? यहाँ पे we have this Asclepius in between, okay, which is signifying some health organization. And here we do not have any Asclepius in between. We just have the world map. So this is suggesting of United Nations. Okay, this is your United Nations Organization's logo, established in the year 1945 after Second World War, headquarters in New York, USA. Okay, so important thing. Next one are your some important other logos. First of all, this is a logo for your World Bank. Okay, this is the logo for your World Bank. Next, this is the logo for your International Red Cross. International Red Cross का logo है ये. Okay, And headquarters for International Red Cross, as we have discussed, they are also located in Geneva, Switzerland. The third one is your logo for your International Labour Organization. Okay, so this यहाँ पे कुछ spinning वाला दिख रहा है ना, so this is your bearing दिख रहा है तुम्हें. So International Labour Organization, headquarters in Geneva or Switzerland. And the last logo that we have over here is for FAO. FAO is Food and Agriculture Organization. FAO is Food and Agriculture Organization. It is a branch of United Nations itself. And the headquarters are located in Rome, Italy, as we have discussed. They have launched the Free from Hunger campaign, FFHC campaign, right? Important one. And we have discussed about everything else. Let's discuss about all the other topics in the last session, right? These are your methods of communication. This is a method of ORS demonstration. ठीक है, ORS demonstration ये दिखा रही है बना के ORS कैसे बनता है. And next is your sociogram. Focus group discussion में मैंने बताया था. All of these are sitting over here. He is the recorder and these are talking in between. He is the leader. ठीक है, so ऐसे 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 बोलते जा रहे हैं. So this is your focus group discussion. Okay, so let's discuss about other all images in the upcoming session. Okay. So till then, goodbye, good luck, and thank you so much for attending today's session. Let's meet in the next session.